Family building is a critical core of all religions. The family unit and the creation of a family unit by having children is something that all people of religious faith are very, very interested in pursuing. We have a philosophy at RMA that we are sensitive to all religious practices, and we'll try to accommodate the practices of any religious person that comes to us. Some religions we're very well versed in, and some we may be less expert in. If we are not expert, we'll try to get information and try very hard to give the patient a mix of the best medical technology within the sensitivities of their religious practice. I personally have a lot of knowledge about Orthodox Jewish religious practice. The religious practice of Orthodox Judaism falls under the doctrine of halakha. Halakha means following the path of the rabbinical teachings to make sure that all of these issues are in accordance with the proper religious practice. At RMA, we have a sensitivity to the patient's needs, and the Orthodox patient has a special need of adherence to religious practice before they can undergo reproductive technology. They need to be certain that there's no violation of the Taharat Mishpacha, which is the purification of the family, the laws of separation of the man and the woman during the menstrual days and the 7 days that follow. There's the need to make certain that we make every effort that the patient does not need to violate the Sabbath when they're undergoing a procedure. And finally, there's a need to have, for those patients whose rabbis insist upon it, an independent religious observer who works for the patient inside the laboratory to witness all the reproductive procedures to make sure that they have been performed in accordance with religious doctrine. One of the critical issues in Orthodox practice is a concept which within Judaism is called Taharat Mishpacha. But this means is purification of the family, that the union of a man and a woman for the creation of a child is something that should be done within Orthodox guidelines and within the practice of the faith. In Orthodox Jewish family, the woman may not have physical contact with her husband during her menses and for 7 days after the menses is completed until she has an opportunity to bathe in a ritual bath, which is called a mikveh. Now, one common problem we see is a woman might be ovulating prior to her being able to be intimate with her husband. We have many simple things that we might do for such a case. We have drug therapies to try to delay the ovulation or shorten the menstrual cycle. One of the problems that commonly comes up in Orthodox couples is semen collection. A modern rabbi might offer an opinion where the couple may safely collect semen through or more standard technique of the man collecting through masturbation. And in fact, many modern rabbis will offer the couple permission to have an insemination done even prior to the woman being able to bathe in the mikveh, in the ritual bath. There is a group of rabbis who will find any semen collection other than through sexual intercourse to be incorrect. And for those couples, we collect semen through sexual intercourse where the man will wear a special device called a sperm collection device. It's similar to a condom, but made of material which is not toxic to the sperm. The semen can be brought in from home. I don't think it's a terrible problem to get the semen here within 2 hours of the time the couple's had intercourse in the appropriate container, as long as the couple carries the semen at body temperature. And I advise my couples carry the container touching your skin under your clothing so it can stay warm. And the semen is usually of excellent quality when we get it. There are many reproductive technologies where semen collection has to be on a very precise date. And for many reasons, the couple may not be able to collect on the day that we need the semen. We might freeze a semen sample in a month where the woman is not trying to conceive. That sample can be safely frozen, stored away, and used for a future reproductive technique. In the case of the woman who may not have been able to go to the mikveh and needs to have an IVF procedure, we can take the frozen semen sample, remove it from the freezer, and put the frozen sample that was then thawed into her eggs and create an embryo independent of the husband collecting a fresh sample. This gives the woman an opportunity of 3 to 5 days longer to get to the ritual bath, to the mikveh, and the embryos can then be safely replaced into the womb without violating any religious practice. Orthodox couples want very badly to be able to observe the Sabbath, the Shabbos. And one of the things that is difficult is the patient can't travel. The patient may not be able to carry materials to the office. The patient can't sign forms. They can't take the elevator. But we're very sensitive to that at RMA. Our first tactic is to try to avoid the situation altogether. Through the use of the reproductive drugs that are often given to the woman for reproductive technologies, we're able to manipulate her cycle and avoid the whole concept of having to come to our office on the Sabbath. Well, sometimes it's not possible. Sometimes the ovary knows better, and the ovary insists that the most opportune day for an egg retrieval will fall on a day that's least convenient for everybody, which would be the Sabbath. Well, patients have accommodations in Manhattan. They stay in a hotel which is within walking distance. They have pre-filled out all of their paperwork in advance, so no paperwork has to be filled out. The procedure is usually, under most interpretations, considered appropriate to perform on the Sabbath as long as the patient does not violate the Sabbath herself and himself. Of course, one would have to go to their personal rabbi to get an opinion about this to make sure that they are comfortable with this. But we try very hard to avoid this situation and to accommodate the patient when they can't avoid a procedure on the Sabbath. Another aspect of Orthodox patients is most rabbis are very accommodating about IVF practice as long as the gametes derive from the woman and the sperm from the husband. However, the rabbis want very badly to assure that the laboratory adheres to quality control standards. And the rabbi will insist that an observer who works for the couple and not for RMA be present in the laboratory to witness the procedures, to be certain that the quality control, to make sure that the sperm and eggs are unified with the appropriate observation has been performed. Now, we at RMA perform a two-person check on every single procedure that we do here. Every time an egg is moved from one dish to another, or semen is moved from one container to another, two independent RMA technologists will witness the procedure. We at RMA are very accommodating in this, and we have two groups of trained observers who we have certified to be in the laboratory as the ombudsmen for the patient, to be certain that their wishes and that their gametes have been properly identified. In the laboratory, if one were to observe the laboratory procedure, every few minutes you'd hear a IVF embryologist call out for a witness to be present to observe the critical steps in the IVF procedure. When one of our patients who requests an observer be present has a procedure, a third person will be called, and the observer who's waiting outside the laboratory will come into the laboratory, and the technicians know not to perform the procedure until the observer walks into the laboratory. Our own internal control check occurs, and then the third set of eyes, the religious observer, performs her own independent check to make certain that they have watched the procedure and that they are comfortable the procedure was done right, so that they can report back to the patient and say they have absolutely nothing to worry about and that the IVF procedure can proceed. Here at RMA, while I am personally knowledgeable about Orthodox Judaism and its implications on fertility practices, we are sensitive to all religious faiths. Everybody must seek a counselor who is an expert within their faith to make sure that we are proceeding within the guidelines of their religious practice, and we make every effort to accommodate the special needs of every religion in the very important goal of procreation and creating a family unit.